Thank you, Chair. This is to Professor Andrew Goddard. I spoke to a Band 5 nurse on a cardiac ward who's a GMB member, and I have to declare I am also a GMB member myself. And he said prior to COVID, we had vacancies on the ward, and as a result, we're short-staffed and also reliant on bank nurses who are usually not specialised in cardiac care. This is to add to the ongoing stress throughout the COVID pandemic. So this is just a real question about whether we are not just testing and retention, but whether we're recruiting enough specialist staff to be able to deal with the capacity for resuming services and clearing the backlog, and whether there are any additional barriers to hiring specialist staff, whether that's immigration policies, Brexit, or the physical travel restraints that the pandemic has caused.
Thank you. All of the above, basically. So we knew that we were short of staff before COVID, short of nurses, as you well have described, and we've been calling for doubling the number of medical students for 2 years now, because we know that the demand is there and it is likely to be there moving forward. I think the challenge is you just can't magic up nurses nor doctors. They need to be trained, and so we've historically in the UK relied on other countries to help us out, either in the short term and in the long term. One of the challenges of COVID, of course, is that people are less likely to want to travel or be able to travel. So our reliance on that immigrant workforce is going to be a bit of a problem. We do need to work with the Home Office, and we were reliant on the Home Office for improving mobility, and particularly with Brexit as well, the impact that's had on EU staff perhaps not wanting to work in the UK. We're getting a bit of a collision of problems. I think there are other bits of the workforce that we can think about, and so for supporting the medical profession, which clearly I know more about than the nursing profession, the advent of physician associates to us was a great thing. These are generalists who can work in multiple settings, and there are things that we can do to improve that. We've been expanding the number of physician associates being trained, but many hospitals find that they are struggling to employ them because they're not regulated. So a simple thing like getting physician associates regulated so they can then prescribe makes them a very useful part of the workforce that we can have, and they'll support both the specialist nurses as well as the doctors. So I think we're going to have to think laterally, but we also have to think bigger.